Today, we're diving into a pretty surprising player in the fight against cancer, a simple trace mineral. We're going to break down the latest research that's connecting selenium to some dramatically different treatment outcomes. So here's the big question, right? Could a single, simple micronutrient really make a difference alongside powerful treatments like chemotherapy and radiotherapy? Well, the data is starting to build a really compelling case that, yeah, it just might.
Okay, let's just jump right in with a number that'll make you sit up. 40%. In a large study, women with higher selenium levels before their breast cancer diagnosis had a 40% lower risk of dying from that cancer. A number like that, well, that's what makes researchers really start paying attention.
So when you see a statistic like that, the big question is this a real connection or is it just a coincidence? To figure that out, we need to understand the two main ways scientists gather proof: by watching what happens in large groups and by stepping in to see if they can cause a specific result.
So you've got two main ways scientists figure this stuff out. On one side, you have observational studies. These are the ones that look at huge groups of people and spot patterns, like that 40% figure we just talked about. They show a link, an association. But then, on the other side, you have interventional clinical trials. This is where scientists actually give patients a specific dose of something, in this case selenium, to see if it directly causes a change. That's where you test for cause and effect.
So, where is this research really making waves? It's not the same across the board for all cancers. The evidence is actually looking particularly strong for a few specific types. So let's zoom in on those.
All right, this is where things get really interesting. Take a look at advanced kidney cancer. In a pilot study, they took patients who had already relapsed on their standard therapy and gave them a high-dose selenium supplement along with the targeted drug. And the results? They were pretty striking.
Just how striking, you ask? Well, get this. In the group that got the highest dose, two people who had previously failed therapy, achieved complete remission. I mean, wow. That's the kind of result that gets researchers really excited and kicks off much bigger trials.
And the story for breast cancer is just as compelling. Studies found that patients with HR2 positive and, especially, triple-negative breast cancer who had higher selenium levels before starting chemo had a way higher rate of what's called a pathologic complete response. That means no detectable cancer after treatment. For TNBC, we're talking odds that were over 6 times higher. That's huge.
And then there's lung cancer. Research following patients during radiotherapy found something, well, remarkable. The patients who were able to keep their selenium levels higher throughout their treatment had a dramatically better chance of survival. In fact, one analysis pointed to a risk reduction of up to 90% for those who maintained their levels best. 90%.
Okay, so all of this just begs the big question. Why? How on earth could this one little mineral be having such a massive impact? Well, researchers have a few key theories about how it might be throwing a wrench in the works for cancer cells.
So here's the key. Selenium isn't thought to be like a direct poison to cancer. It's more clever than that. It seems to work in 3 main ways. First, it might help disrupt a pathway cancer cells use to survive and resist drugs, which basically makes the therapies work better. Second, your body needs it for a strong immune response. And third, it can help lower system-wide inflammation, which we know can just pour fuel on the fire for cancer growth.
Okay, so we've seen all this exciting, promising data. But now, we have to hit the pause button and have a really important conversation about the reality here. This is not as simple as just running out to buy a supplement, and it's absolutely vital to understand the risks.
First things first, let's be absolutely crystal clear about prevention versus treatment. The evidence for taking selenium supplements to prevent cancer is mixed at best. It is not generally recommended. In fact, some studies even show potential risks. The promising research we've been talking about is specifically about its role during active treatment for certain cancers, and always under medical guidance.
And this right here, this is the single most important takeaway. The doses used in these promising clinical trials are very high, way beyond a typical daily supplement. Selenium has what's called a narrow therapeutic window, which is a fancy way of saying the line between a helpful dose and a toxic one is incredibly thin. This absolutely requires management by an oncologist or a medical professional, no exceptions.
You know, the source material puts this into perspective. A 4,000 microgram dose might sound abstract, but it's the equivalent of eating a massive amount, 8 to 12 ounces of Brazil nuts. And while that helps you picture the dose, it also drives home the danger. Selenium toxicity is a real concern with serious side effects, which just hammers home the point this is not a do-it-yourself approach.
So what's the point of all this information? Well, the goal of this explainer and of the research itself is definitely not to provide medical advice. It's to arm you with high-quality information so you can have a more empowered and informed conversation with your healthcare team.
So let's just quickly summarize the crucial points. 1. We're seeing strong data linking higher selenium levels to better outcomes in certain cancers, like breast, lung, and kidney. 2. Those early clinical trials using high-dose selenium alongside therapy are showing some really exciting results. But 3, and most importantly, this is not a do-it-yourself therapy. High doses carry a real risk of toxicity and must be managed by a doctor.
And that leaves us with a final thought. The landscape of cancer care is constantly evolving, and this research is a perfect example of that. So, armed with this kind of knowledge, you can be a more active partner in your own care, and isn't that what it's all about?